Hello everyone, you're welcome to my YouTube channel. I'll be discussing histoplasmosis, which is a lung infection caused by the fungus known as Histoplasma capsulatum. It is a dimorphic fungus existing in nature or in culture as a mold with tuberculate microconidia and as a yeast or in yeast form at body temperature. There are certain persons that are at risk of contracting histoplasmosis. These include the following: the microbiology laboratory worker, the spelunker or cave explorer, construction worker, demolition worker, farmer, gardener. Others include bridge inspector, painter, heating and air conditioning system installer or service person, pest control worker, roofer, restorer of historic or abandoned buildings. What are the clinical manifestations of histoplasmosis? Histoplasmosis can occur as acute pulmonary histoplasmosis, which presents as mild influenza-like respiratory illness, and there are several symptoms which include malaise, fever, chest pain, dry or non-productive cough. Other symptoms include headache, shortness of breath, joint and muscle pains, chills, loss of appetite, and hoarseness. Chronic pulmonary histoplasmosis resembles tuberculosis and can worsen over months or years. The most severe rare form of this disease is disseminated histoplasmosis, which involves spreading of the fungus to other organs outside the lungs. This often occurs in immunocompromised or immunodeficient patients, such as hematomegaly, splenomegaly, lymphadenopathy, and bone marrow involvement. Ocular lesions are some of the symptoms that are observed. Laboratory diagnosis of histoplasmosis will involve the detection of tuberculate macroconidia in a wet mount preparation using lactophenol blue. Also, detection of antigen in body fluids, such as blood, urine, using enzyme immunoassay and radioimmunoassay protocol, which measures histoplasma capsulatum polysaccharide antigen levels in the body fluid of patients. Prevention and control of histoplasmosis. Histoplasmosis occurs in areas where persons that cannot afford chemical fertilizers now use bird or bat droppings, which have been aged, and in the process of applying these bat or bird droppings containing the spores of Histoplasma capsulatum, the materials become aerosolized and subsequently they are inhaled. So to prevent this, such persons must avoid contact with materials which can easily be aerosolized and subsequently inhaled. So you can use face mask. It's very important for persons with weakened immune systems. Also, dust suppression methods can be used, such as carefully wetting the dust or the accumulated bath or bird droppings containing Histoplasma capsulatum. This can be useful for reducing the amount of material aerosolized during such activity. Again, wearing of personal protective equipment may be needed to further reduce the risk of inhaling spores of Histoplasma capsulatum, such as removing bad droppings or bad manure from an enclosed place. Treatment of histoplasmosis will involve the following. Mild cases of histoplasmosis are usually self-limiting. That is, they can resolve without treatment. For severe cases, special antifungal medications are needed. These include amphotericin B and the azoles, which include itraconazole and fluconazole. Disseminated histoplasmosis is fatal if untreated, but deaths have been reported in some patients even when medical treatment has been received. This is common among the immunocompromised patients with other underlying diseases. Here are some selected references for further reading. Thank you for listening.